All right, good morning, everyone. The ICF Training and Technical Assistance Team is honored to welcome you to this California Housing and Community. Sorry, y'all, my screen went blank. Okay, I'm sorry. But we are pleased to welcome you to the California Housing and Community Development Workshop offered through the Emergency Solutions Grant Coronavirus Relief Consulting and Staffing Services Contract. I am Kimberly Simpson from ICF, and I will be hosting today's session. Today's training session is part of our new and non-traditional providers workshop series where we will discuss ESG and ESG-CV street outreach. It is my pleasure to hand this presentation over to our first presenter, Mike Thomas.
Thank you very much. Good morning, everyone. My name is Michael Thomas. I am a technical assistance provider with ICF. I use he, him pronouns. I'm here with my co-presenter, Gordon Levine. I'll let Gordon introduce himself before we get started.
Good morning, everyone. My name is Gordon Levine. My pronouns are he, him, and I'm a lead homeless services. I've forgotten the last word of my title, but I'm with ICF and I am a technical assistance provider. Happy to be here. Thanks, Mike.
All right, so we'll go ahead and jump in. As you can see there, we are going to be covering Emergency Solutions Grant Street Outreach today. So we will get right in. Next slide, please. So here's our agenda. We are first going to go through an overview of street outreach through the ESG program. Then we're going to talk about COVID-19 waivers and alternative requirements that affect this project type. We will talk about best practices for street outreach. And then depending on where we are with time, we may or may not take an intermission. This presentation is a little lighter than some of our other ones that we have done. So we're going to play that by ear. So we may have an intermission, we may not, we'll see. But in any case, we would then move on to our lightning round where we will ask some questions of you, throw up some polls and see what we've learned. And then we should have plenty of time for question and answer at the end. Next slide, please. So just a quick reminder for those who might not have joined these sessions before, these are focused on the subrecipient and sub-subrecipient level. So when we think about the ESG program, that funding comes directly from HUD to, in this case, the recipient, which is California HCD. And then California HCD gives that money through contract to subrecipients, and then they may also pass it down to sub-subrecipients via their own contracts. So this session is going to be focused on the subrecipient and sub-subrecipient level of that tier. Next slide, please. And we also like to go over some of the alphabet soup that you might hear us using throughout the presentation so that we're all on the same page with what we're talking about. ESG is the Emergency Solutions Grant Program. ESG-CV is the same program, but with funding provided through the CARES Act. If you hear us say SO or ESG-SO, that is street outreach projects funded through either ESG or ESG-CV. FY is fiscal year. That is the year in which ESG funds are allocated by HUD. CAHCD is, of course, the California Department of Housing and Community Development, which is the largest ESG recipient in the state of California. HUD is the U.S. Department of Housing and Urban Development. A recipient is an entity that receives ESG directly from HUD, like California HCD. A subrecipient is a local government entity or nonprofit that receives ESG from a recipient. They are sometimes also called grantees. We try to stick with the recipient, subrecipient convention in these presentations. And then finally, an UGLUG is a unit of general local government, my favorite acronym. Next slide, please. And then a reminder on how regulations and policies interact. So as we talk about policies and things like that, it's important to understand that for this federal funding source, there are multiple layers of policy with which recipients and subrecipients need to comply. That generally starts at the top with the federal uniform guidance, which covers administrative and financial practices around federal awards, and it goes across the vast majority of federal awards. And then the layer below that would be the ESG interim rule. That is the piece of regulation that affects the ESG program specifically. And then the layer below that is HUD guidance. So there we're talking about responses to questions that you might submit to HUD. We are talking about HUD's frequently asked questions. And in this instance, we're also talking about the ESG-CV notices that HUD has released over the last few years. And then finally, you have local policies. So ESG recipients and subrecipients are required to have certain written standards, and there may be other local policies, and that's the final layer at the bottom. It's just important to understand that for compliance purposes, programs have to adhere to all of these requirements. So generally, when you start at the top from the federal uniform guidance and work your way down, the policies can get more restrictive, but they cannot get less restrictive. Next slide, please. I will turn it over to Gordon to get into the basics.
All right, thank you, Mike. Before we do that, just two notes. One, folks are dropping their names, pronouns, and organization names in the chat. That's wonderful. And I want to say thank you to so many folks who are putting their pronouns in that. That's a small piece of accessibility, but an important piece of inclusion for people of all genders. So thank you for doing that. Also, as you have questions as you go along, please do drop them in the chat. Depending on the question, we will either answer them on the spot if it's quick and applicable to what we're discussing, or else we'll hold it for the Q&A at the end. But it's great to get those in as they occur to you so that we can have answers prepped for you by the end. So do utilize the chat box. We'll be glad to see you in there. We're going to dive into street outreach basics. So street outreach in a nutshell is providing essential services necessary to reach out to unsheltered homeless people, connecting them with emergency shelter, housing, or critical services, and providing urgent non-facility-based care to unsheltered homeless people who are unwilling or unable to access emergency shelter, housing, or an appropriate health facility. And even without the citation at the bottom, I guarantee most of you would know that that is regulatory language from the ESG program interim rule. And you can tell as we go through this presentation, we're going to elaborate on this definition and really talk about what it means. But one of the ways that you can tell that this is regulatory language and not best practices language is that this tells you everything that you can do with street outreach, not what you ought to do. And the bulk of the presentation today is not about what you can do, but how you ought to do it. So street outreach, in general, is the cost of identifying people experiencing unsheltered homelessness, addressing their emergency needs, and helping them return to housing by providing or referring them to services, including direct returns to housing. And that last clause, including direct returns to housing, is part of what we're talking about in terms of this is how you should do things. Street outreach can provide services at central locations, like drop-in centers, or in the field, or both. They're not required to pick one. They can provide services anywhere that people who are experiencing unsheltered homelessness gather. ESG-funded street outreach is the only homelessness dedicated federal source that can provide longer term, not long-term, but longer term, case management and services to any person experiencing unsheltered homelessness. It's underlined and has an asterisk under it because there are like 15 different exceptions. But it's important to note because all of the exceptions or complications to that are limited in some way. So for example, there are other homelessness dedicated federal sources that can provide the same level of services, but they're subpopulation restricted to youth or to veterans. Or there are general purpose federal sources that can fund street outreach and case management for as long as you want, but they're not homelessness dedicated like CDBG, for example. ESG street outreach is special because it can serve everybody experiencing homelessness, irrespective of subpopulation, and the money isn't going to go anywhere other than homelessness. And when we talk about ESG, the reality is that compared to many other funding sources, it's simply not a very big funding source, but it is an incredibly important funding source because it often has the flexibility that those other funding sources don't. On to talking about eligible participants. So these are folks who may be served, can be served by ESG street outreach. Two categories of people. One is HUD's definition, category 1 of HUD's definition of homelessness, also called the Hearth definition of homelessness, called literal homelessness, which refers to, in this case, an individual or family, a person or group of people who lack a fixed, regular nighttime residence, meaning that they live in a public or private place not meant for human habitation. Note that this is an abbreviated version of the full Category 1 definition and uses only the unsheltered definition. Literal homelessness actually covers a much broader range of people, including people who are living in shelter, people who are living in alternatives to shelter, like publicly paid hotel motels, people who are exiting short-term institutional stays, certain other criteria. For street outreach, we're only talking about people who are living in an unsheltered location, which means a public or private place not meant for human habitation. It also includes people who meet the Category 4 definition, which is people who are fleeing or attempting to flee domestic violence. That definition is any individual or family or any person or group of people who are fleeing or attempting to flee domestic violence, and they have no other residence, and they lack the support networks to obtain other permanent housing. However, to be eligible for ESG street outreach, people who are fleeing DV must also meet the requirements of the literally homeless definition as described to the left. Note that this category is understood to include human trafficking, also includes dating, violence, sexual assault, and stalking. For youth, the definition is even broader. We had a really good question on a previous presentation that I'm going to address right here because it came up last time and it came up sort of repeatedly, which is, if for street outreach, there are two eligible categories of homelessness, Category 1 and Category 4. But to qualify for services, if you're Category 4, you also need to be Category 1. Why would you ever care about Category 4 since the basic core criteria is Category 1? I'm going to pop over to the next slide and I'm going to give you the answer. Never mind, wrong slide. The core thing that we're getting at here, the core criteria for eligibility for street outreach is literal homelessness. It is that I am living in an unsheltered location. Category 4 certification is important for a couple of different reasons. One of them, which is to do with access to the emergency transfer policy that's baked into the ESG interim rule, doesn't apply to people who are not housed. But the really important one is that certification as fleeing or attempting to flee domestic violence, number one, can be a requirement for accessing ESG projects that are dedicated to serving exclusively people who are fleeing domestic violence, which exist and are perfectly legitimate implementations. And so if you've got a DV only street outreach project, you've got to certify the person as fleeing domestic violence. Number one, but number two, it also unlocks certain transfer features and protections under the ESG program interim rule that require you to have been certified as fleeing domestic violence at time of project intake, as opposed to experiencing DV after that. And so this is sort of a long and meandering way of saying that the core criteria for entry to any street outreach project is going to be that literal homelessness definition. But Category 4 certification is important if the person is fleeing domestic violence because it may unlock access to certain other resources. Hop over to the next slide. Special note on documenting eligibility. All ESG projects are required to document eligibility and what's called HUD's order of documentation priority, which goes third party first, then caseworker observation, then self-certification. Street outreach projects are no different. They're required to follow that order of priority. However, HUD recognizes that third-party documentation is often not feasible for street outreach, often just doesn't make sense for street outreach either, as street outreach is so often a provider of documentation rather than a requirer of documentation. For street outreach, as well as emergency shelter, self-certification is always acceptable, irrespective of whether you've got or not got anything else. And furthermore, lack of third-party documentation must never prevent someone from immediately receiving ESG street outreach services. And what that means is ultimately, if your street outreach practice is you meet somebody in the field and you say, hey, I'd really love to serve you, but we're going to need to have somebody verify that you're really experiencing unsheltered homelessness before we begin providing services. That's not a best practice. In fact, that's counter to HUD's expectations of eligibility. So really, you should be allowing people to self-certify as experiencing unsheltered homelessness without barriers. Turning back over to Mike for eligible activities.
Thank you, Gordon. So let's talk about what you can do with that street outreach funding once you have identified the proper population. Next slide, please. So these are the eligible activities baked into the ESG program interim rule. You have engagement, you have case management, emergency health services, emergency mental health services, transportation, and then services for special populations. And there are a lot of additional things in the regulation for each of these, and these will benefit from further explanation. So that is what we are going to do right now. Next slide, please. So the term engagement. The way that it is included in the interim rule is defined very broadly. It essentially means initial assessment of needs and eligibility, crisis counseling, addressing urgent physical needs, and that can mean things like meals, blankets, clothes, and toiletries. It's frequently a catch-all, but just remember that it says urgent. So it's not buying bags of toiletries and handing them out arbitrarily. It is making sure that you're engaging people, handing those out because it is an urgent need of those people, and also kind of using it as a hook to get them engaged with your outreach team so that you can start talking to them about what their move to a permanent housing solution might look like. It also means connecting and providing information and referrals to programs targeted to people experiencing homelessness and mainstream social services and housing programs. So that includes emergency shelter, community-based services, all housing types offered by ESG and the COC program. Cell phone costs of outreach workers as they perform engagement activities are also eligible under that line item. Next slide, please. So here we have case management. It is also very broadly defined. What you will notice is that this slide says basically the exact same thing as engagement, except for it's under case management. The reason for that is that the activities are pretty much the same between engagement and case management. It's really just a matter of when they happen in the process. So when you're talking about engagement, that's usually the upfront process, the first process where you're getting to know someone who's living unsheltered. You're engaging them to start talking about what their needs are, what their next steps are as they desire them to be. And then case management is the next step in the process where the person is engaged with your outreach worker and you're providing active case management to start talking through an assessment of barriers to housing, potentially talking to them about getting into an emergency shelter if that's what they desire. So case management is kind of the next step in the process. What I'm really saying is it's the same stuff between engagement and case management. It happens at different times. Most budgets aren't really going to get into a level of detail where they're asking for one or the other, but if they do and you need to track it that way, that's how you would think about it. What part of the process are you at with a particular person that you're working with? Next slide, please.
Mike, can I interrupt for just a moment? We had a great question in the chat from Madeline, who asked, would shower services be included as eligible under this activity category?
I'm sorry, could you repeat it? I didn't quite hear the last part.
Sure. The question was, under this activity category, would shower services be eligible?
Shower services are generally not built in under the regular ESG program. There is an exception, not for showers, but for hand washing stations under the ESG-CV waivers, which we're going to talk about in a moment. But generally, no, shower services are not included under the ESG program interim rule.
All right, thank you.
Yep. All right, so emergency health services. When we talk about emergency health, it's direct outpatient treatment provided by a licensed medical professional in a community-based setting. That's really important to pay attention to. It must be a licensed professional, and it can't just be in their office. It must be in a community-based setting, which can include places like where people are experiencing unsheltered homelessness, encampments on the streets, places where they live and gather. In some instances, it can also be in a shelter, depending on the situation, but in most cases that's going to be available through the shelter provider. So there's kind of a gray area there, but in general, this is going to be community-based settings where people experiencing unsheltered homelessness live and gather. It's only to the extent that equivalent services are inaccessible or unavailable. So that's important to pay attention to as well. If the services are available through another source, or if they're easily accessible through another source, then this wouldn't be eligible under street outreach. Eligible costs include health assessment and treatment plans, helping participants understand medical needs, providing or referring for emergency medical treatment, and providing medication and follow-up services. The next one is emergency mental health services. The restrictions on that are pretty much the same as they are for emergency health services. It must be a licensed professional. It must be in a community-based setting, as we discussed. And then those same services cannot be easily accessible or available from another source. Eligible costs there under mental health services would be crisis interventions, prescribing psychotropic medication, explaining medication use and management, and then combinations of therapeutic approaches to address multiple problems that the individual may be experiencing. Next slide, please.
I'm going to break in with another question.
Yeah.
Where would dentistry fall in here? Is that an eligible cost?
I do not believe dentistry is an eligible cost because it is not specifically spelled out. So like under emergency health services, they're pretty specific about health assessment and treatment plans and all of that stuff. And it seems, in my interpretation, it has always been that it is referring explicitly to health services, which I don't disagree that dental is a health service, but it's not explicitly spelled out. So in the ESG programs I've worked with, we've generally taken a conservative approach and said dentistry is not eligible there. However, that is a great use for flexible funding if you have access to it.
Cool. And just to follow up to make really clear, there was a question in the chat. What if there is an infection? And I think the question is, what if it's an emergency as opposed to sort of maintenance dental work? It's still, you would still say ineligible?
That's a good delineation. If there is an infection that requires treatment that is going, like if the infection is going to affect the person's health, then my argument, if I were running that program, would be that it is an eligible expense. I do think there is room for interpretation there. That's what my interpretation would be. So yeah, that's a good delineation. Like routine, having a cleaning, having the dentist do a checkup, I would say is probably not eligible under ESG. However, if there is an infection that is going to cause the person to experience adverse health effects, I would say it's eligible.
Cool. I agree. For what it's
yeah.
worth. I think we're
Perfect.
All right. Sounds good. Thank you. Thank you for letting me bug you.
Yeah.
Here's the next slide.
All right, next cost we're going to talk about is transportation. So that's the travel of service providers during the provision of street outreach services.
When I went to the lady,
Excuse me there. If I could get everyone to hit their mute button.
All right, Stephanie Rodriguez, you are off mute. Thank you.
All right. So transportation, that's travel of service providers during the provision of street outreach services. Do want to point out that during the provision of street outreach services is the important part there. It also includes the cost of transporting participants to shelters or other service facilities, and that can include public transit costs. And that includes the cost for staff to travel with participants. If service workers own vehicles and use them during street outreach, then mileage allowances are allowable. And the cost of purchasing or leasing a vehicle and the associated operations costs for that vehicle, if as it is being used for street outreach. That is, those are all eligible costs. Something we've gone through in presentations around street outreach before that I'm going to touch on here is the idea that during the provision of street outreach services is very important. The example we have used is if you buy, say, a bus pass for someone, and the idea is that they are going to use that bus pass to go and receive an essential service from a provider that provides that essential service that's eligible under street outreach, that is an eligible transportation cost. If they take that bus pass that you have given them for that purpose and they use it to go to the water park instead, then their action has made that bus pass an ineligible cost. So it's really important to keep track of how those things are used if you're providing resources like that to participants, because in some instances, the action that they take might make the cost ineligible. And sometimes there's not a lot you can do about that, unfortunately. But thinking about that actively is always a good idea. Documenting things with federal programs is incredibly important. And then finally, we have services for special populations. I'm going to tell you what the regulations say. They say that the preceding costs are eligible when serving the following subpopulations. So all the costs we've talked about are also eligible for youth aged under 24, people fleeing domestic violence, and people living with HIV and AIDS. I have never been a huge fan of this section of the regulation because all of these services would have been available for those populations anyway. Our understanding is that maybe there was something going on at the federal level when they were writing the program interim rule that made them anxious about services being withheld from these populations, and potentially that's why it's in there. Maybe it was a messaging thing. We don't really know. Point being, this is in the regulation. You probably don't need to pay much more attention to it. Just be aware that it exists there. Next slide, please.
Sure. I would just also add that those aren't the only special populations that are available to be served. It's
yeah,
you really just safely ignore that section.
Yeah, agreed. All right, back to you, Gordon.
All right, back over to me. So waivers and alternative requirements. So applicability here, the waivers and flexibilities described in this section really apply in two ways. They apply to funding received or activities carried out under ESG funding distributed through the CARES Act, which is usually called ESG-CV, and under annual ESG from federal fiscal year 2020 and earlier when used to prepare, prevent, or respond to COVID-19, which is usually called the PPR tieback, if you're into acronyms. So waivers and alternative requirements. First of all, the match requirement is waived. ESG usually requires a 100% match for funds used in this way. The requirement is gone. There is no match requirement. Low barrier assistance. People experiencing homelessness may not be required to receive treatment or perform any other prerequisite activity as a condition for receiving shelter, rental assistance, or other services. So the goal is to make services as low barrier as possible. Additional eligible activities under the waivers and flexibilities. Please do note that this is a selection of these. Conditions and restrictions may apply to these. There may be other restrictions. There may be other activities or restrictions that are available in the notices. If you're looking at these, we strongly encourage you to review the actual notice where it exists, and those notices are cited at the bottom of the slide. They're available on the HUD Exchange. That's where you would go to review them. And I will say very much to HUD's credit that most of those notices and waivers are written in a way that make them easy to navigate and understand, even if you are not hyper familiar with ESG. And so it is really a good resource just to look back at the primary sources for those. So additional eligible activities include volunteer incentives for necessary COVID-19 relief services, hazard pay for people who are providing direct COVID-19 relief services. So that would be people who are doing case management that puts them in sort of the hazard pay situation. It wouldn't include, for example, your administrative staff if they're not also in that situation. It includes training to direct staff on infectious disease prevention and mitigation. It includes cell phones and internet access for program participants while in the ESG program. This, again, is intended to equip people to participate remotely in services to prevent and reduce the spread of COVID-19 and other diseases. It includes personal protective equipment or PPE for program participants. It does not include PPE for staff, though my 2 cents, I think you could probably argue for that under emergency supplies. Again, it's not in the ESG program interim rule, and so that might be a good place to go to the HUD Exchange's Ask a Question section if it was something you were interested in. Also a great place for flex funding. Everywhere is a great place for flex funding. It includes vaccine incentives, up to $50 per person per dose when other incentives are not available. This is really talking about incentives for participants. It includes laundry services for people experiencing unsheltered homelessness. And as Mike said earlier, it includes hand washing stations and portable bathrooms at outdoor locations. This really is intended, again, to provide people who are experiencing homelessness with access to sanitary facilities, and to prevent, again, the spread of infectious disease. Mike, I see you're off mute. What's up?
Yeah, may I jump in with something from the chat?
I love it.
So on the topic of mobile showers again, would you consider a mobile shower station to be justified for the prevention of COVID-19, or perhaps if someone has received lice treatment and need a shower related to that? What's your take on that?
I think it's a complicated question, and I think your best stop is to go to the AAQ and ask there. I can tell you what I personally think, but when we get into these edge case scenarios, right, we can tell you what the rule says, and we can tell you what our interpretation is. And we can give you a level of confidence with our interpretation, but some of this really is gray. And if you want a definitive answer, your best way to get a definitive answer is to go to the HUD Exchange, and I'm confident Mike is going to drop a link to that in the chat. Use the Ask a Question function under ESG and say, hey, is this cost eligible? And you'll get a response. Hard to say what the turnaround time is. It's usually pretty quick, especially for questions like the shower question, which I'm confident has been asked before. Yeah, that's where I would turn with it. From my perspective, just my 2 cents on this one. Whenever you're asking, is this thing that isn't explicitly eligible, you have to look at what is eligible and see if you can wedge it in. And imagine if you're being monitored by HUD, whether you could explain this expense that you documented well at the time with a straight face. And if you feel like you can do that, you're probably in an okay position. But if you're a little queasy about it, then it might not be. For shower stations specifically, I think I would have felt very differently about it at the beginning of 2020, when the best medical information available to us was that COVID-19 was spread by surface contact. But given that the medical information that is publicly available to us now indicates that COVID-19 is overwhelmingly likely to be spread primarily by aerosols, it's hard for me to see how a shower station would be an appropriate COVID-19 response, which doesn't mean that it's not a good thing for people experiencing unsheltered homelessness to have access to sanitary facilities. It is obviously a good thing, but that doesn't necessarily make it an eligible cost under this funding source, which again means flex funding. Finally, again, that's just my interpretation, and the AAQ is a great next stop for that question. Mike, anything you wanted to add to that?
I think AAQ is exactly what I would have said, specifically because the ESG-CV waivers, they do specify hand washing stations. And when they say portable bathrooms, they even use the example porta potties. So they're not talking about a full-scale portable bathroom. They're talking about a lavatory facility, generally speaking. So I think if you want a definitive answer, AAQ is a good bet. I agree.
Yep. All right, sounds good. Other questions on the chat, or are we good to go?
Sorry, we are good to go.
Thanks, appreciate it. All right, other requirements, best practices, over to you, Mike.
Thank you. Next slide, please. All right, so other things associated with the ESG program interim rule. First, we're going to talk about, this is a HUD requirement. This is the maintenance of effort requirement. If you are a unit of general purpose local government, or an UGLUG, there's that acronym. We don't get to use it very often. I think there's a different word for that too. Acronym might not be right. Anyway, I digress. Street outreach cannot replace funds that the local government provided for street outreach during the preceding 12-month period without permission from HUD. So you cannot use these federal dollars in a local government to displace local funds that were being used for the same thing during the preceding 12 months. The only circumstances under which you can do that is if HUD has determined, I can't remember the exact term, but basically that the local government is in a dire financial situation and would have to stop their activities without the federal funding replacing the local funding. And I think that's going to be few and far between. So general rule here, don't displace local funds. If you add ESG funds into the situation, it has to be an addition. It can't be a replacement on the local funds. Next slide, please. Coordinated entry participation. This is another HUD requirement. All ESG funded program or projects must use the coordinated entry system of the local continuum of care. What this means for street outreach is going to vary between COCs because different continua of care set up their coordinated entry systems differently. And that setup can affect what the interaction with street outreach looks like. Some of the things you see frequently, though, are that street outreach might be a primary provider of coordinated entry services, meaning that the outreach workers might be trained to administer the assessment that the local COC is using. So that means that they would be doing intake, providing access to coordinated entry, and performing the actual assessment. Street outreach often also plays a role in gathering participant eligibility documentation and establishing chronic homeless status because, because street outreach interacts with people experiencing unsheltered homelessness and often the most vulnerable people out there, they're in a very good position to verify that the person is living unsheltered, that the person has been living unsheltered for some time, and can often help provide documentation along those lines. And I know this is a topic we talk a lot about. I don't know, do you want to add anything on coordinated entry, Gordon, or do you think I'm good?
Ooh, I want to add lots of things on coordinated entry. So I think the only thing that I want to add here is that the requirement for ESG street outreach is that ESG street outreach must feed into the coordinated entry system. But it is not this, but what it is saying is that ESG street outreach must feed into the coordinated entry system. What it's not saying is that ESG street outreach must be entirely contained within the coordinated entry system and cannot provide alternative routes to housing. Coordinated entry is a powerful tool. It's incredibly important. I love coordinated entry. It's where my heart lives, but there are other routes to housing other than coordinated entry, and street outreach should take advantage of everything at their disposal, including housing through coordinated entry, housing through other options like, for example, housing choice vouchers and public housing, and permanent housing through activities like housing problem solving, which you might also hear called diversion and rapid exit. So I would say just keep in mind that coordinated entry participation doesn't mean just coordinated entry participation.
Perfect, thank you. Next slide, please. So next HUD requirement, Homeless Management Information System, or HMIS. Street outreach projects must record participant data in HMIS. We have an asterisk there because if the agency is a victim service provider or there is a very limited set of legal services providers that would not use HMIS, but would use a comparable database instead. But there is still a requirement for them to collect data. It just happens in a slightly different place. Bottom line, data must be collected. For most projects, it's going to be in the HMIS system. There is no regulatory requirement about how soon after services data must be recorded. But California HCD, the subrecipient, or the COC may create local requirements around what it means to enter data in a timely fashion. So just be aware that can vary a little from place to place. Best practice is to enter the data as soon as possible. This is a good argument for using tablets and things of that nature as part of street outreach because you can do it as you go. Some programs also use paper documents where they write things down and then enter it later. Not as ideal as a tablet, but also an approach that you can use to get that real-time data. So ideally, as with the tablets and things, data would be recorded at the time of service delivery. Street outreach data is something that is challenging because you are engaging the most vulnerable people on the streets, and they don't always want to tell you the things that HUD tells you you need to collect. And so it's important to note that with street outreach, data can be collected incrementally. That is okay when you engage a person if they don't want to tell you their name, or they don't want to tell you any part of their social security number. They don't want to tell you their birthday. That's understandable. I probably wouldn't want to tell someone approaching me if I were living on the street all of those things either. And so that data collection process can look a little different for street outreach than it does for other project types. So I just want to acknowledge that and let you know that it is okay to collect that data incrementally for street outreach. There can be some effects on data quality. I would encourage you to work with your local continuum of care and the ESG, whoever holds your ESG contract on those issues, just to make sure that you're all aware. Next slide, please. Policies and procedures. This is a requirement of California HCD. So ESG money coming from HCD. You must have written policies and procedures for your street outreach project. Those must include how the project will comply with applicable ESG and COC written standards, what geographic area will be covered by your outreach efforts, how the project will integrate with coordinated entry, how the project will establish and document participant eligibility, what services the project will offer, the staffing pattern for the project, how the project will provide diversion and rapid exit approaches. We're going to talk a little more about that in a moment. How the project will comply with any additional federal, state, or local requirements that might exist in your area. And then finally, those policies and procedures must contain sufficient information about the overall project's operations so that a reasonable person could pick up those policies and procedures and then replicate the project. So you're really trying to document how that project operates for contingency purposes as well. So these are all things that should be included in policies and procedures for your project. Next slide, please. And back to you, Gordon.
All right, thank you. So where to serve people? This is an interesting question. We touched on this a little bit earlier. We're going to talk about, as I said earlier, not just what you can do, but what you really ought to do. ESG Street Outreach can provide services at a central location and or in places where people experiencing unsheltered homelessness live and gather, including other services facilities and in the field. And other services facilities is really defined. It's really a placeholder for just stinking anywhere, right? So it could mean something from like a drop-in center, or it could mean like an emergency shelter that operates a walk-in lunch, all the way to like community centers and faith-based facilities, and really anywhere that people experiencing homelessness can be found out in the world that is not living in an emergency shelter, right? That's what that's intended to cover. So the question that is often asked, and in my opinion is often answered incorrectly, is which of these models is correct? Should we do a central location or should we be out in the field? And the answer that often happens, maybe it's not what people intend, but what often happens. The answer that we often get is we're going to do mostly like site-based. And it's understandable why. We're going to talk about that in a second. Ideally, though, you want to do a mix, right? You want to go to those central locations and you want to be in the field because each model will reach participants that the other model simply will not. And really that site-based thing is a trap, right? It's the in-reach trap, where staff spend too much time at single site locations, regardless of who's funding them or what they are, and never really contact the people who don't actively request services. And this is a trap because the people who don't request services intuitively are among the hardest to reach folks. And the members of that population often have the highest service needs and really complex housing barriers. And so what ends up happening if you overinvest your staff time at single site outreach, at in-reach, is that number one, you're going to get the easiest folks to serve because they're going to be the folks who you would tend to get the easiest folks to serve because people who can self-advocate enough to show up and request services at a single site have a tendency to be the people who are most capable of doing so, have a tendency to have lower service needs, and so on and so on. Requesting services demonstrates capacity. Conversely, you will, and I'm sorry, by the same token, the people who show up to single site locations have a tendency to show up a lot. It's not like people experiencing homelessness, if they are inclined to show up for example, a lunch option at your local emergency shelter, are going to show up once and then just never show up again. They're probably going to show up every week for that same thing. If they're showing up at a faith-based location, they're probably going to show up at the faith-based location. And so if you're doing just single site outreach, you're going to keep hitting the same people over and over, which is great. You're serving those people well, but you're missing a segment of your population that really needs services. And so having a mix of those things where you're dealing with folks that you frequently see at these single site locations and providing consistent services, that's great. But also you need to make sure that you're getting out into the field and locating folks who you would not normally come into contact with if you're just making the rounds to 5 single sites, because those folks are in need of services, are underserved, and at a COC level, at a community level, will give you insights into your homeless population that you simply would otherwise miss, period, because you just don't, you literally do not see them. So that's my soapbox on that one. Mike, anything you want to add there? I know this is important to you too.
I think you covered it really well. I agree with everything you said. I don't think I have anything to add, but I really appreciate you going through it so thoroughly.
Oh, well, thank you for saying so. All right. So what is ESG? I love this. So what is ESG street outreach actually for? And this is in bright red. So we put this in bright red because it really, if you take nothing else away from today, we really want to make sure that you take this slide away from you. We put it so bright that I have now turned red on camera because my screen is reflecting it back to me. The goal of ESG street outreach is to identify people experiencing unsheltered homelessness, provide them with emergency services, which means stabilizing them, and then getting them back to housing, which means safe, secure, and stable housing as quickly as possible. What is not the goal is getting them into emergency shelter. And this is the #1 mistake that people make with street outreach. There's this idea that is born out of historical praxis and a misunderstanding of what housing is and can be, and sort of the pipeline from homelessness back to housing that says, first you're unsheltered, and then you're sheltered, and then you're in coordinated entry, and then you receive housing from Rapid, and then a permanent housing voucher or a permanent supportive housing voucher or a Section 8 voucher comes through. And that's the pipeline everybody goes through. And it's just not true. It's hardly ever true, in fact, because vouchers are incredibly scarce, and because emergency shelters are full, and because there are many more people experiencing unsheltered homelessness who return to housing in the absence of vouchers than there are people who return to housing with a voucher. And because this is especially true in California, of everywhere in the country. And so this idea that when you meet a person experiencing unsheltered homelessness, the first thing you do is get them into shelter. If you can't get them into shelter, then what you do is work on getting them into shelter, is wrong. It's absolutely wrong. Emergency shelter is an emergency response. It's not always available. It doesn't work for everybody. Not everybody wants it. And it's not a substitute for housing. Everything an emergency shelter project does should be aimed at returning people to safe, stable housing in the most direct way possible, regardless of whether shelter is involved. And a lot of times that means we keep mentioning it. We're going to keep mentioning it. That means housing problem solving, also called diversion and rapid exit or homelessness prevention. There's a lot of different names for it. But what it means basically is a mediation-based approach that says, hey, okay, you're experiencing unsheltered homelessness. Why weren't you last week? Why weren't you last month? Where were you living then? Can you be back there now? What about with your aunt? Can I talk to your aunt? What would break down that barrier? Is it a little bit of money? Can we make a one-time payment? Would that take care of that? And it's an incredibly effective technique. It's an emerging technique, though it's not a new one, but as a practice, right, as a body of practice, it's emerging. But early adopter communities are seeing better than 50% success rates with people experiencing first-time homelessness, returning them to housing via case management, mediation, and these like one-time subsidies, which incidentally mostly cannot be paid for with ESG, the one-off subsidies. The case management, on the other hand, absolutely can be. And so providing these alternative routes to housing, or being housing focused, which is what we're really talking about, right? Having a housing focused mindset in your case management is the core, the heart and the root of street outreach. And getting folks into shelter could be a great idea if it works for that person and if shelter is available, but only if it's a tool to alleviating a crisis or to resolving an episode of homelessness. So what I would have you all take away from this is that street outreach and everything else that we do in homeless services is about getting people back to safe and stable housing. And so everything you should rotate around that principle. And anything that doesn't serve that, or that is a detour, or that seems like it might kind of contribute, but isn't, that you can't really draw a direct line, you want to really seriously reconsider taking that action, because it might not be contributing to what we're ultimately here to do. Mike, again, I know you feel strongly about this one too. Anything you want to add?
Yeah, I think the only addition I'm going to make, it's really just pulling on a string that you've already mentioned, is the aspect of, is it what the person wants? You know, shelter to house, so streets to shelter to housing is a pathway to getting out of homelessness. It absolutely is. In fact, I just worked on that exact pathway for another presentation we're putting together. But it is not the only pathway, as Gordon mentioned, and a big piece of determining if that's the right pathway is client choice. There are a million reasons a person might not want to go into a shelter. They might have a perception about the conditions at that shelter. One of the biggest ones that always comes to my mind is they might have a pet that they don't want to take into the shelter with them. Although I understand that California might have some public funding available to help shelters deal with that issue, which I think is just amazing. But if a shelter doesn't take pets, that can be a reason a person wouldn't want to be there. So that's the only thread. I'm pulling on that one a little. Client choice. What does that person want? That's what it's all about. And that should be a driving factor in determining which pathway out of homelessness they take. All right, off my soapbox. Thanks, Gordon.
All right, well, anytime, I'm happy to share the soapbox. I was certainly up there long enough myself. Moving on the subject of further best practices, we're going to talk a little bit about our foundational elements. This really is a sort of expansion on what we just said. Street outreach ought to be housing first, right? It should have an immediate focus on safe and stable housing tonight or as soon as possible. A low barrier to services, including no treatment or ID requirements, and housing focused case management, like we just talked about. Assistance, as Mike just said, should be participant driven. Really, it's about determining what participants need, want, and will engage, which is about listening to participants, asking questions, and then following their lead, and then providing it, and not basing your services on preconceptions about what the right way is back to housing. It's about staff readiness and support, which means onboarding and ongoing training, defining what your staff's core competencies ought to be, providing crisis resolution and response, both training and cultural shifts, and dealing with staff secondary trauma. I've seen a lot of different aspects of this work, and there are not a lot of them that are more traumatizing to staff, either who work directly or indirectly with participants, than street outreach. Street outreach is hard and traumatizing and very difficult. And providing support for that is a critical element of maintaining a healthy street outreach project. Essential services and partnerships, excuse me. It does mean providing access to shelter and other emergency services, like, for example, healthcare services. Benefits application assistance. So SSI, SSDI is a significant source of income for our participants. Income's a significant barrier to housing. That's a pretty easy marriage. DV services, critically important. Many people in the homeless population, regardless of where you are experiencing some form or have experienced some form of domestic violence. Many more than who then will identify immediately as experiencing DV, and so making those services widely available is important. And subpopulation specific services, which is really beyond the scope of what we're talking about, but if you know, you know. Finally, progressive engagement and assistance. As we discussed earlier, it is unreasonable to expect as a street outreach worker that you go up to somebody who is clearly sleeping in a park and say, hey, can I have your first and last name, social security number, phone number, email address, Facebook ID, get you into shelter tonight, and then we'll get you back to housing tomorrow. That person is going to tell you to blow off, because that is an absolutely outrageous way to approach people. Progressive engagement recognizes that that is not a reasonable approach, and very few people respond to it, and instead recognizes that, like, before you can start doing the housing focused case management, you need to build rapport with people and demonstrate to them, first of all, that you're safe. Second of all, that you actually have something to offer. And third, that you're not going to just disappear. And the reason those three things are important is because those are all problems, either with street outreach as it has been performed historically, or with other forms of services that are provided to people experiencing homelessness. So being safe and reliable and present is a great way to build rapport, and building rapport is a foundational element to beginning to provide the services people need to get them back to housing. We're going to just blow right through here on the housing focus. We really talked about this earlier. All services ought to be focused on getting people from homelessness to permanent housing as quickly as possible. And all of your services should be oriented around that. The only thing I want to highlight here, because I know it's important to me, I know it's important to Mike too, there's this mindset in street outreach, as there is in all forms of homeless services, where the people in this business are here basically because they don't like seeing people in pain and want to help, which means that we want to go into it and we see something that appears to be broken or damaged or in pain, and we want to fix that hurt. We want to heal that injury. And that's often not what we're here to do under street outreach, under ESG, under homeless services. It's about housing. And the reason we say that it's about housing and not healing and not about fixing, first of all, the idea that people are broken and need to be fixed it bears critical examination. People aren't broken, people are harmed, people are in trauma. But the reason it's not about healing, it's about housing, is because housing is often a prerequisite to healing, right? If we want people to be healthy, whole, safe, stable, and well, you have to address the immediate stuff first. And what we know is that if you get someone back into housing from homelessness, a lot of that healing stuff starts falling into place. Conversely, if you do not address the housing piece, that healing stuff will never happen, or will be very difficult, or will be complicated by additional trauma that continues to occur because the experience of homelessness is itself traumatizing. And so when you hear us talk about housing first, you really ought to hear not housing only, but housing now and then the other stuff, because that's what housing first is about, recognizing that housing is foundational and the other stuff comes after that. It's not the end of the road, but it's the beginning. In terms of practical implementation of the soapboxy stuff that we just said, really what we're talking about is a project intake, creating a housing plan, which identifies barriers to tenancy, connecting participants to housing resources that can address the needs in that housing plan, using the housing plan as a tool in all of your meetings with participant once they've begun to engage in a serious way, and frequently updating that housing plan as barriers are knocked down and as new barriers present themselves, with the goal of working through your housing plan and coming out the other end with housing, passing the participant off either to subsidized housing case management or to self-rented housing in which they are stable and secure. Mike, anything you want to add on there?
No, I think that is a good coverage of it. And yeah, practical ways to implement the things that we have kind of been going through for the last few slides. I appreciate it. Yep, nothing to add. Okay,
sounds good. Chris, over to you.
Thanks, Gordon. Thanks, Mike. And thanks, everybody, for hanging with us. We are at noon on Pacific time. So we're going to take our 5-minute break. So return at 12:05 Pacific. And we will go into our lightning round and answer any questions you have. So if there are questions that have been nagging you that you haven't entered into the chat, go ahead and do that now. I'll capture those during the break, and we will see you back here at 12:05. Thanks for rejoining us for the second half of our session today. Just want to raise up something that Seamus put in the chat, that, you know, in street outreach, it's really important when you're building that relationship and building that rapport to keep your word. We agree, so much so that we are kept our word and kept our break to 5 minutes. We all could have used longer, but you want to deliver on what you are saying to folks in crisis, to folks in an unsheltered situation. Making promises you can't keep is the worst thing out there. So thanks for raising that up, Seamus. Really appreciate that. With that, I'm going to launch it into our lightning round. And if I'm not mistaken, Mike, you were going to take the first one.
Yeah, that would be me. So let's jump right in and see what we have learned. Next slide, please.
Mike, before we launch into that, do you want to do ground rules?
Yeah, sure. That's a good point. We usually do that. We end up backtracking and doing that after the first question a lot of times, don't we? So the ground rules are, we're going to put a question up just like this. You will have a poll that will pop up on your screen, and it will have the different options. You will choose which one you like the most, and we will be looking at what comes through in terms of answers, and then we'll show you the correct answer. Do want to point out that this is completely anonymous. We cannot tell who is answering what. And I think on most of these, if not all, there's going to be a not sure option, and it is always okay to say not sure. We want high participation, so please answer, even if you don't know. It's okay to not know. Federal regulations are tough. Programs governed by federal regulations are tough. We don't always know the right answer, as you've seen from some of our conversation today. So just be aware, not sure is always a perfectly fine answer with ESG. Did I miss anything? All right.
No, but we both said exactly the same thing about not being sure. You in the chat. You out loud, me in the chat. Yeah, 100%.
Nice. All right, so let's jump in. Question 1. This is a true or false to start you off. So true or false? ESG street outreach is only one very specific funding source among several federal programs dedicated to street outreach to those experiencing unsheltered homelessness. So is ESG only one of several programs that provide street outreach to people experiencing unsheltered homelessness? Go ahead and put in, and you'll see your poll there. You've got choice 1, choice 2, and not sure. Those are always going to be ordered the same way that they are on your slide. So choice 1 correlates to true, choice 2 to false, and on this one, not sure is your third option. And I cannot see results, so I will just leave it up to our hosts to let us know when it looks like a decent percentage of people have answered, and then we can move on to show you the correct answer.
And I would just encourage everybody to respond, even if you're not sure, even if you feel like, even if you're not sure, even if you're not feeling it, try and feel it a little. The reality is this is a learning tool for y'all. And by participating, you will get more out of this than if you don't. So think about the question, plonk your answer in, participate, and we'd love to have you here.
While you're putting those in, I will say I appreciate you noting in the chat that sometimes we're not sure, Gordon. Sometimes we are sure.
Yeah, we're absolutely positively sure about some things. We're frequently unsure about some things.
I would say unsure or in the gray area more often than not, which is not a bad thing. All right, looks like we've got the majority of people taking choice 1 there. So let's go ahead and see what the correct answer is. It was false. This was a little bit of a tricky question. We do like tricky questions, so we started off with one that was kind of tricky. As we mentioned earlier in the presentation, there are actually very few dedicated federal resources for street outreach. And additionally, most of those other federal resources must be earmarked for outreach at the local level with things like CDBG, or they're dedicated to very specific subpopulations, such as the PATH program, which cannot serve the general homeless population. So just, again, tricky question. Apologize for starting you off with one that's a little tricky, but that is the correct answer. And we can move on to question 2.
Okay, so question 2, which of the following is true? Which is true regarding documenting eligibility for street outreach project participants? Which of these is true? That third-party documentation is required, that staff observations are common for documenting street outreach eligibility, that some programs may limit self-certification as a best practice for street outreach, or that special documentation requirements apply to those fleeing DB. Which of these is true? I'll tell you right now, one of them is true. Others are not. This one's a little tricky too.
It is a little tricky. I think eliminating the ones that you know are not true is a good approach to this one.
That's a very Sherlock Holmesy answer. When you eliminate the options that are not true about street outreach, you're left with what is probable for street outreach.
Also, the best way to take the GRE, if anyone has ever done that.
All right, well, let's get the poll on up there. Yeah, once we've got the majority of folks answering, I think we can put the answer up on screen. So overwhelmingly, the answer was number 2, staff observations are common for documenting street outreach eligibility. Let's find out. You're absolutely correct. That is often the most feasible and accurate method, since street outreach workers engage regularly with the unsheltered population. Self-certification is also acceptable and frankly common, and a lack of third-party documentation, as we said earlier, should never, ever be a barrier to receiving services. Back over to you, Mike.
All right, number 3. Which of the following is not true regarding eligible street outreach activities? So in all those eligible activities we talked about, which of these is not true? So both engagement and case management are broadly defined and cover a variety of activities. Travel costs for service workers engaged in outreach activities are eligible. Health services must be provided by a licensed professional in a community-based setting. And health services are eligible even if they are available and accessible from another source. Which of those is not true? And there's your poll. All right. All right, let's go ahead and take a look at the answers. Choice 4 was the popular one. Health services are eligible, even if they are available and accessible from another source. Let's take a look at the correct answer. Yep, that is the correct answer. Health and mental health services are only eligible to the extent that equivalent services are unavailable or inaccessible. All other items on this slide are, of course, true for your outreach projects. Next slide.
Muted, sorry. All right, question 4. Which of the following is not an additional eligible street outreach expense or activity associated with COVID-19 waivers and flexibilities? Which of these is not an additional eligible activity? Is it hand washing stations, lodging in hotels, motels, volunteer incentives, or laundry services? This is a truly wicked question, and you are a truly wicked person.
There is at least one on here that I hope everyone knows is eligible.
Cool. Yeah. Kim, go ahead and give us the poll when the majority have answered. We're good there. Okay, so this interesting. So just to give you an idea of the trickiness of the question, a quarter of you said lodging and hotel motel, a quarter of you said volunteer incentives, and about half of you said laundry services. So let's have a look. Which is not an eligible. The answer is hotel motel stays. Hotel motel stays are not eligible expenses for street outreach projects. However, hotel motel vouchers are eligible for ESG emergency shelter projects. All of the other expenses listed here are explicitly eligible for street outreach projects. Tricky, tricky. Back over to you, Mike.
All right, question 5 is another true or false. So true or false, ESG street outreach projects are required to participate in the local continuum of care coordinated entry process. Is that true or false? We'll acknowledge that for those of you who are very new to emergency solutions grants programs, you might not be incredibly familiar with your local COC processes. So this could be something relatively new to you, and that is okay. You have a lot of continua of care in California, and there's the potential for a lot of different processes. So if you're not totally familiar, no worries. But the basics here, are you required to participate?
I love the idea that this slide could be someone's first introduction to coordinated entry.
Yeah. There must be an introduction to it somewhere, right?
Yeah, I may this be it.
And look, that's yeah, it's about a 2/3 of people roughly say true, and then most of the rest saying false, and a couple of not sure's. But the answer there is true. All ESG funded projects are required to use the local coordinated entry system. And so for street outreach, this often means providing intake, access, and assessment for coordinated entry. Outreach projects also frequently play a role in documenting homelessness and establishing chronic homeless status, as we talked about before. So participation looks a little different for a street outreach project than it would for maybe a shelter project or a rapid rehousing project, but you are required to participate. And that is that. Next slide.
Okay, next question. Which of the following is not true regarding data collection for street outreach projects? Which of these is not true regarding data collection for street outreach projects? Is it untrue that all ESG street outreach is required to collect participant data, that all data must be entered into HMIS or a comparable database when applicable, that there is no need to record short and sporadic participant contact in HMIS, or that data may be entered in HMIS over time as it is learned? Which of these is not true? Which of these is not true? We recognize this one's a little extra tricky just because it's HMIS, and HMIS is often a complex topic, especially for people who are street outreach focused. So it's tricky. Just be brave, answer what you think. We'll get to the right answer and we'll all learn a little something.
Yeah, you know, much like coordinated entry, HMIS might be particularly new to you as well if this is your first foray into federally funded homeless services. So it can certainly be a tricky topic. We could do a week's worth of webinars just on HMIS or coordinated entry.
Yeah, I feel like I could talk for a year straight on HMIS without breathing. I mean, I would pass out, obviously, but I could if I tried. Overwhelmingly, the bare majority of you said there is no need to record short and sporadic participant contact in HMIS, that's not true. Let's have a look. Yeah, you got it. All contact with participants should ideally be recorded in HMIS. You know, this plays a role in how HUD reports are populated and establishes an overall contact pattern. All projects are required to collect data and enter it into HMIS or a comparable database if you're a victim services provider. For street outreach, it is acceptable to begin a client record with minimal data and add to it as more is learned over time. Good question. Over to you again, Mike.
Nicely done on that one, everyone. Good job. All right, question 7. Which of the following is not a best practice for street outreach projects? So which of these is not best practice? Street outreach projects should focus on housing with or without shelter as a step in the process. Outreach staff should make sure to spend plenty of time at service locations, as this is where people experiencing homelessness are likely to be found. Outreach should implement a progressive engagement approach that moves at the pace chosen by participants. And outreach should seek to provide immediate resources necessary for safety. One of those is not a best practice, and we harped on it quite a bit.
Harped is such a strong word. I prefer to think of it as trumpeting myself.
I'll take that. We trumpeted
in honor of my part, bassooning in honor of my partner.
Who plays bassoon? That's pretty cool.
She would certainly say so.
All right, let's see what we have.
Mr. Chris Pitcher trumpeting in the chat.
It's like the majority chose choice 2, spending plenty of time at service locations. Let's take a look at the right answer because that is it. Outreach staff should avoid the in-reach trap. We did talk a lot about that. In-reach involves spending too much time at service facilities. While you will find people there who are experiencing homelessness, this is not where you're likely to find the most vulnerable and hard to reach. Outreach activities should always be driven by housing first, participant choice, and safety. So justifying those other points there, but yes, avoid the in-reach trap. Nicely done, everyone.
You avoided the in-reach trap question. Well done there. Question 8, true or false? The primary purpose of street outreach is to connect participants with emergency shelter as quickly as possible. Is that true or false? This also was bassooned pretty hard, so expecting significant results from y'all. True or false? The primary purpose of outreach is to connect people with shelter as quickly as possible. Might have even oboed a little bit on this one too. All the nonsense woodwinds, really. All right. Interesting. Okay. 70% false, overwhelmingly. Let's have a look. Absolutely false. Positively false. Bassoonily false. The primary purpose of street outreach is to identify people who are experiencing unsheltered homelessness, provide them with emergency services, and this is the key one, get them to permanent housing as quickly as possible. Shelter may be a step in that process and should always be offered as a safety option when available and when it's something the participant wants. However, shelter placement is not the objective. It's not the goal, it's not the heart, it's not the root. It's just a step on the path for some people. Good job, y'all. That takes us into the end of our presentation. Here are some resources that may be relevant to y'all. I would highlight in particular the USICH Core Elements of Effective Street Outreach is a really good primer. I've certainly used it when I was putting together presentations just like this one to remind me of the best thoughts of folks who are responsible for collating those best thoughts. But all of this is useful. Takes us into Q&A, and I'll kick this back over to Mr. Chris Pitcher.
Thanks, Gordon. You go ahead and take the slides down as well. Let folks get on camera if they want to. We have no questions lined up at the moment. So I will just make a few statements while folks think of their questions. You can come off mute, come on camera, raise your hand, put it in the chat, whatever makes sense for you today. I will say that the art available to us in Zoom did not allow me to find a harp or an oboe or any of those problematic woodwinds, I believe you said. But I was looking for them, Gordon, while you thought. So yes, please get your questions out here and ready. I think in two of the things that I really took from the conversation today, the first is housing problem solving, something that we can do as a street outreach provider and should do because we've seen the promising outcomes of that. But a lot of the interventions that we need to make housing problem solving really work aren't things that we can necessarily pay for. So that work in and of itself is a very collaborative type of operation. And I think the second is, street outreach is meant to be on the streets, right? So street outreach in in-reach mode, we've created a lot of rules at HUD to kind of discourage in-reach, but they never use the actual words that we're using. Don't just set up at a shelter. Don't just set up somewhere. There are places where it's convenient to hit a bunch of folks at once, absolutely. But your job as street outreach folks is to build rapport, is to build a relationship. And I'm going to take this one step further. We didn't talk about this today, but the ability for our street outreach providers to continue to work with clients after they're housed in shelter or after they're housed in rapid rehousing is something that is very much a cornerstone of what we expect for ESG street outreach. However, there are rules that wean out in-reach that look like they say, hey, we can't do this we can do this. We can take someone from the streets, get them into shelter. And if we're the reason they're staying in shelter and keeping them at least temporarily housed, we can continue to meet with that client. If we get a client into rapid rehousing and they're struggling, and the struggle is real, folks that have been on the street have built community, and you put them in their own apartment, they don't have that community. They can get very lonely, very stressed, and oftentimes you as a street average person is the only connection they really have. So if you need to keep that going for a while, that's great. That is also not an opportunity to get around being in reach and just like saying, I'm just going to go hang out with all my rapid rehousing folks who used to be on the street. That's not the idea. But those are a kind of a few of the things that I took from the session today that were really important to me. So I wonder if anyone else has any questions or like to come off mute and ask a question or create a statement. This is a discussion space as well. If there are things that don't make sense that we said, that we'd love to hear that. Okay. I feel like I'm going to take a first stab at this question from Lizette, and then Gordon, I think you're the next most appropriate person to follow me up. What type of data collection system can providers use for domestic violence victims? Can it be a log kept at the shelter locations? So I am going to pull this apart because there's a few things in here I think we need to talk about. If you are receiving federal funds that require the use of HMIS, but you are a domestic violence provider, a victim service provider to be exact, a VSP, you are required, you are prohibited is the word I wanted, prohibited by law, the Violence Against Women Act, from using HMIS. But if you're getting ESG or COC funds, or even other federal funds, you may have to use a comparable database. So most of our domestic violence providers that receive funding through the state of California are using a comparable database, and there are a few providers out there that do that. I am not going to endorse any of them, but there are a few. There are also several HMIS solution providers that provide their data system for domestic violence providers as well at a low cost. What we can say is a log being kept at the shelter location was likely not meet the HMIS data collection requirements. It may meet self-certification requirements or other requirements that you have for documentation, but not necessarily the HMIS requirements, which for the victims of domestic violence turn into a comparable database. The other piece that I'll say on this is you, if you're not a victim service provider, are serving victims of domestic violence. Not that you could be, that you are. And I can say that very confidently, given the amount of violence that happens within our homeless populations. So there are definitely someone, if you have a 100-person shelter, there's probably a lot of folks in there that have domestic violence. We are not prohibited from putting those folks into HMIS unless we ourselves are a victim service provider. Gordon, what were the holes in my logic there?
There weren't any holes in your logic. And in fact, I would go so far as to say that not recommending a specific HMIS comparable database is the best decision I've ever heard anyone make. I would add a couple of things that might help inform folks. So my sense, and I apologize if I mispronounce your name, but Lisette, my sense is that what you're asking ultimately is, how do we comply with HUD's requirement that we as a victim services provider enter data into an HMIS comparable database if nobody is going to tell us what an HMIS comparable database is? You've got a couple of resources. One of them, and this is going to be the least accessible one, is I just dropped the HMIS data standards into the chat. These are updated, I think, on an annual basis, biannual basis. Biennial basis, whichever one means every other year. They clearly describe the data elements that need to be collected for various programs, including ESG, and are extremely relevant to your implementation. It's also a really big and broad topic. If it's like if you're thirsty, instead of drinking a glass of water, like going out and buying a water truck and then trying to drink that. It's just way more information than you need. A better way to try and answer that question is to ask people whose job it is to answer that question for you. And my recommendations are that you talk to any of the following or all of the following 3 entities. Number 1, every COC has an HMIS lead agency that is responsible, among other things, for administering that COC's HMIS. They're going to be able to give you guidance about, yeah, I buy the truck. I was going to say something funny, but it's gone. Talk to your HMIS lead. It's their job to know about your COC's HMIS implementation. And they're going to be able to tell you, among other things, whether your general HMIS provider also offers an option for victim services providers. The answer may well be yes. First, and second, whether they recommend it, which could be a personal preference, but could also give you some useful information. Then third, they might be able to tell you what other victim services providers are doing in your COC and outside of it. It's number 1. Number 2, you do have a statewide DV coalition. They care a lot about your data that you're putting into an HMIS comparable database. Talk to them and ask what other folks are using, and ask not just what do other people like, but what are the problems that they're running into. Finally, ask your other VSPs, because they're the folks using the software. And there's no better way to understand what you're getting yourself into in terms of the pluses and also the deltas than asking somebody who's had to deal with it. The only other thing that I would add is that I have yet to meet an HMIS system that is perfect. In fact, I've yet to meet an HMIS system that's anywhere near perfect. All of them have strengths and vulnerabilities. All of them have things that they are very good at, and all of them have things that they are not particularly good at. It's true of general HMIS providers, it's true of VSP only providers, it's true of services for both. And so really what you ultimately need to figure out as a victim services provider is what software best meets our needs while most effectively meeting HUD's data standards. And part of that is going to be cost, part of that is usability, part of that is flexibility of system versus like it just works right out of the box. All of those are things that you want to talk to people who understand HMIS before making a commitment to purchase. I think that's what I would add. You're very welcome. Incidentally, I have worked with all of the systems that have been mentioned in the chat so far, and they are systems that are used and that I would not go out on a limb to recommend, not because they are necessarily better or worse than anything else, but because there are options and you should assess your options is kind of what I would get.
Yeah, thanks, Gordon. Thank you for your question. Is that I hope I said your name right. I was taking a totally French name for that. And Michelle, thank you for sharing in your system, the system that you use as a victim service provider. Are there any other questions surrounding street outreach that we can answer today?
It occurs to me that we should probably recommend not using Empower DB. Might be the only recommendation that we do make is not Empower DB.
And can you remind me why?
Because they are extremely publicly not a compliance HMIS in HMIS compliance software and are dropping support for HMIS compliance.
Yep, that's the part I remembered.
Yep, and that's the one.
Okay. I'm not seeing any other questions out there. Anyone want to come off mute and say anything? If not, we will cease today's session. All right, Kim, take us home.
All right, thanks, Mike and Gordon, for the presentation on street outreach. And thank you all for attending this California Housing and Community Development Community Workshop session offered through the Emergency Solutions Grant, Coronavirus Relief Consulting and Staffing Services Contract. Look out for more on the next new and non-traditional providers workshop series session. A 3-question survey will pop up as the session ends. Please make sure you complete that survey so we can know what training sessions are useful to you all. You all have a good afternoon and see you next time.
Thanks, y'all. Have a good one.